But suffice it to say that we now, all of us, fully understand what we're up against. And we are taking every conceivable action as a city, working with the state government and now increasingly working with the federal government to address this crisis, to try in every way we can to slow the growth of this disease, to help everyone in need, and to get through to the day when this will be part of our history, not the reality we're living. Right now, for so many people, it's just a day-to-day adjustment, trying to figure out how to live with these new rules, trying to figure out how to adapt. For so many people, trying to figure out how to get the basics of life, even if you aren't being paid anymore, you don't have a job anymore. So much uncertainty, so much fear, so much anxiety. That's what I hear everywhere I go. Look, what we all have to do is help each other, but we in government particularly have to help you to understand this new reality and help you navigate it, support you through it. And so I'll talk about some of the big picture reality, but I'll also keep coming back to the day-to-day reality, how important it is for us all to stay home to the maximum extent possible, to really understand that what we do will affect the overall situation, not just for ourselves and our families, but for everyone else. And that social distancing is so important for all of us. I will tell you again these very painful facts about the situation in our city right now. Confirmed cases as of the last count this morning, already 12,339 New Yorkers have tested positive for COVID-19. I want people to understand that at this point, we're about 60% of the cases in New York State are here in our city. About 35% of the cases in the entire country are here in this city. We are the epicenter of this crisis. No one wants that distinction, not a single one of us, but it is true that we are the epicenter of this crisis. And that's why we so desperately need help, particularly from our federal government, to get through it. As I said, as of this moment, 99 confirmed deaths related to coronavirus. We know more are coming, and that, again, those are not statistics. Those are human beings. Those are friends. Those are loved ones. The breakout by borough. Queens has 3,621 cases, Brooklyn 3,494, Manhattan 2,572, the Bronx 1,829, and Staten Island 817. It's a very tough time, but it is not a time for people to give up, to say the least, because this fight has just begun. It is not a time for hopelessness, because we finally see things starting to happen. And first and foremost, New Yorkers are making things happen. I had the opportunity today to be on Roosevelt Island visiting the Kohler Hospital facility. And there, right this minute, new hospital beds are being created right now so that we will have additional capacity to handle this surge in coronavirus cases, and to make sure that everyone else who needs hospital care for other diseases and challenges will have support as well. On Roosevelt Island at Kohler, 100 new beds will be available this week. 240 will be available next week. It's just one example of many to come where we're finding new ways to create hospital space for those who need it. And of course, we heard great news today about the Javits Center. And so happy to say the Army Corps of Engineers, working with FEMA, working with the state of New York, all of us working together, setting up a new field hospital at the Javits Center. This was something absolutely crucial, and we've been pushing for the federal government to bring in everything they have, every form of support, and everyone knows the great work of the Army Corps of Engineers. This will mean 1,000 new beds. That's going to be extraordinarily helpful. I want to talk about supplies as well, which are absolutely crucial. Equipment and supplies we're going to need to get through not only this crisis over many weeks, but what we need to do to get through just the next days, just the next week or two. And I do want to say on a positive note, I had a long and detailed conversation last night with President Trump and Vice President Pence. And we got into real specifics about the challenges facing New York City. I emphasized to both the President and Vice President that we, particularly in our public hospitals, are dealing with, honestly, a day-to-day reality where we have to make sure that there'll be more and more equipment and supplies coming in to deal with a surging demand of people in need. I'm very pleased to say that conversation focused on ventilators in particular as the single most important, most urgently needed piece of equipment. And today, we received the good news that 400 ventilators from the federal stockpile are arriving now to help New York City. That's going to make a huge difference. Now, our need for ventilators is in the thousands, but we're going to fight every day to stay ahead of this curve. We're going to literally be in a race against time. So even 400 ventilators is a huge step forward to help us get through this week and into next. So I'm very grateful the federal government has come through with this first step. I also had conversations today with Peter Navarro, several conversations, who the president deployed as the individual he's going to have focusing on specific supply requests from New York City. We've talked multiple times today. We've been texting back and forth. And again, the focus that I made clear to Mr. Navarro is ventilators, but other supplies as well are part of his purview. And again, we see very productive actions in the course of today. I spoke with Defense Secretary Esper about an hour ago. Continue to emphasize how much we need the military's help here in New York City. I want to thank the Secretary for the fact that the USNS Comfort is on its way soon to New York. Obviously, are so appreciative for the presence of the Army Corps engineers. But we are going to need so much more going forward. And then when New York gets through our crisis, the same help is going to be needed from the military all over the nation. So it is my hope that that military role will continue to expand in the days ahead. When it comes to supplies, we have been amassing supplies and ensuring that they get out immediately to public and private hospitals across the city. And starting today, we sent out supplies around the city in total, 200,000 N95 masks for our hospitals, 2 million surgical masks, and 70,000 face shields. Additional help is coming from both the federal government and the state government. That includes 430,000 more surgical masks, 170,000 more N95 masks, 175,000 pairs of gloves, 98,000 face shields, and 72,000 surgical gowns. So we'll be given regular updates, but you can see these are substantial quantities, and yet I think everyone knows we're going to need constantly to get a supply because the number of cases will keep growing and the number of medical personnel that we're going to need will keep expanding, the number of facilities will keep expanding. So these numbers represent something good, which is the flow of supplies to where they're needed. But we're going to need a lot more where that came from. And we're going to focus on getting supplies from all over the country, from obviously the federal, state government, any private sources we can find, any philanthropic sources, and we're going to be manufacturing our own here in New York City, because we're going to be at this for a while. We're going to need all of that to get through. There are some companies that have really stepped up. I think it's really important to give credit where credit is due. So I want to thank the ASO Corporation of Florida, who has sent 600,000 vinyl gloves to New York City. I want to thank American Express for putting together 36,000 N95 masks. Merck Pharmaceuticals sending 500,000 surgical masks. And then companies here that are stepping up to produce right here in New York City: Boyce Technologies, Bednark Studios, Makerspace, and Adafruit, all local companies that have agreed to help us by producing tens of thousands of face shields right here in New York City. All of this is going to make a difference. Every single one of these efforts matters, and this is how we save lives, to make sure these supplies are always available to our brave and heroic healthcare workers. So thank you to all these companies for stepping up. Want to make clear, as we all get into this new reality, we all have been told, I think, very, very clearly to think about the difference between what's essential and what's not essential. At this point, since we passed 8 p.m. Last night, non-essential businesses, non-essential activities are a part of the past, and that's going to be true for weeks to come. So non-essential businesses closed down. The things we all used to think were normal, the things we used to do for leisure and fun, the things we used to spend time and money on, we're not doing that anymore, honestly. We're doing something different now. So essential businesses are what are allowed to be open: grocery stores, pharmacies, food establishments that provide delivery and takeout. Obviously, the kinds of businesses that we are going to depend on to get through this. And another thing we have to recognize will be different. We're New Yorkers, we're used to crowds, we're used to lines, we're used to being close together. Not anymore. We're not going to allow crowds to form. We're not going to allow lines where people are tightly packed next to each other. We're not going to allow any indoor space to get overcrowded. We're not going to allow outdoor spaces to get overcrowded. From this point on, everyone needs to understand social distancing, 6 feet apart on every side. The obvious exception is when you're with the people who live under the same roof with you. The family, whatever the composition of your family, those you live with. Obviously that's different because you're in close proximity all the time. And if you live with someone else and you're out on the street just the same way as you would be living together, close together, that's fine, we understand that. But for people who you do not live under the same roof with, you're going to have to practice the social distancing, and we're going to help. The City of New York, all our agencies will be there to educate people, to remind people, to warn people, sometimes to step in and help people create more separation. We're going to be doing that very, very energetically from this point on. And we've made clear that everyone we understand who has to go out for groceries or for medicines or for a little bit of exercise or walk the dog, that's okay, but for as little time as possible. And there are some people who should not go out, and those are the folks who are the most vulnerable, the folks who really have to avoid any other contact with other people. And that means, especially outside their family, obviously, and that means folks over 70, and folks with those serious pre-existing conditions, medical conditions. So now to the question of our parks and the places that we are used to going outside. We want to get some exercise, some recreation. As Commissioner Dermot Shea and I said yesterday, we're going to focus in the first days on education and warnings, and a lot of NYPD presence, and also the presence of many other city agencies, obviously the Parks Department included. We're going to focus, we're going to have signage out to help people understand, lots of messages that you'll hear constantly, letting people know how this is going to work, and that you have to practice social distancing, and that if we see people in groups, we're going to break them up. If we see a place that's too crowded, we're going to get people to disperse. And also, I want to say to my fellow New Yorkers, this week's going to be decisive. We want to see how this is going. We're going to work with the state of New York to figure out what the rules, I should say, will be for the longer term. This week is our chance to test different approaches. We need to make sure people will practice social distancing on our parks and playgrounds. And if we don't think it can be done, we're going to have to come up with tougher rules. So it really is incumbent upon all New Yorkers to do your damnedest to live by this new reality. As our officers go around monitoring and enforcing, the more we see people practicing social distancing, the more we see people avoiding crowds and really creating some space, the more we can allow folks the opportunity to use parks and playgrounds fully. If we see that we're just not seeing enough evidence of people getting the message, we're going to be tougher about getting that message out and more enforcement. If that's still not working, we could easily get to the point soon where we say, you know what, we're not going to be able to allow playgrounds to be open. I don't want to do that. I don't think a lot of New Yorkers want to see that happen. But the only way we keep playgrounds open is if people really honor the rules, don't overcrowd them. We don't need family groups mixing with each other. We don't need kids playing with kids outside their families. I know it's strange. I know it's difficult. I really do. But this is a reality we have to make sense of. So if everyone is tough and strong as New Yorkers are, we can find a way to strike that balance. What will not be allowed in parks at all is any larger gatherings and no team sports activity, which again pains me as someone who loves sports and still plays team sports. It's just not going to be possible. Team sports pretty much in every case involves close contact. It does not allow for social distancing. So this has to be something that we just let go for now, but hopefully in the months ahead we can all get back to. We're also not going to allow barbecues, which obviously are social activities. We know that's going to be tough as the weather gets warmer, but again, that's just for the duration of this immediate crisis. And then when we get through it, we can go back to normal. So you will see a lot of enforcement, a lot of personnel. You will see first and foremost the NYPD that is going to make this a high priority to be present around parks and playgrounds. But you're also going to see teams from the FDNY. You're going to see teams from the Sheriff's Office, from the Office of Special Enforcement, from the Department of Buildings. You're going to see teams from the Sanitation Department, our Community Affairs Unit here at the Mayor's Office, our Office of Neighborhood Safety at the Mayor's Office, and of course from the Department of Parks and Recreation. You're going to see in every case a lot of presence. And please, I'm going to state the obvious to my fellow New Yorkers. When an officer asks you to move along, move along. If they ask you to disperse as part of a crowd, disperse. If they remind you that you've been out exercising, it's time to go home, go home. We really need people to recognize our officers are simply telling us what we need to do to keep safe and to stop this disease from continuing its extraordinary growth. That's the whole mission will be to keep people safe now and in the future. So please follow the instructions of our officers. Some other
Okay, Mayor de Blasio's daily briefing there again, now emphasizing familiar themes, social distancing in the city, in particular parks. He's emphasizing that if it doesn't work out, if people don't follow those rules, NYPD trying to enforce it, if it doesn't work out, he's going to end up shutting down the parks. The mayor also talking about how supplies are so key in this time of need, having masks and having surgical masks and face shields and so on. He said the federal government is stepping up in a big way to make that happen, as are private companies. And he also reiterated how New York City remains the epicenter of the outbreak in this country. 12,339 confirmed cases so far, 99 confirmed deaths in the city. Those numbers will continue to mount as testing continues to become more widespread around the state, city, and the country.